the Senior Emergency Officer for the Health Emergencies Program. With this, let me now hand over to the Director General for the opening remarks.
Thank you, Christian. Good morning, good afternoon, and good evening. WHO is deeply concerned about the unfolding humanitarian emergency in Ukraine. WHO is on the ground, working with our partners to respond, to assess the impact of the conflict on the health of Ukraine's people and its health system, and to deliver essential medical supplies from our hub in Dubai. The first shipment will arrive in Poland tomorrow, including 36 metric tons of supplies for trauma care and emergency surgery to meet the needs of 1,000 patients and other health supplies to meet the needs of 150,000 people. Prior to the conflict, WHO distributed emergency supplies to 23 hospitals, although our prepositioned supplies in Kiev are currently inaccessible. There is an urgent need to establish a corridor to ensure humanitarian workers and supplies have safe and continuous access to reach people in need. To support our response, WHO has so far released $5.2 million from our contingency fund for emergencies. Our needs for the next 3 months are $45 million for Ukraine and $12.5 million to support neighboring countries to care for refugees. Anyone can contribute to support our response through the WHO Foundation appeal page by going to www.whofoundation and clicking on Donate. We are also deeply concerned about reports of attacks on health facilities and health workers. We have received several unconfirmed reports of attacks on hospitals and health infrastructure, and one confirmed incident last week in which a hospital came under heavy weapons attack, killing 4 people and injuring 10, including 6 health workers. We are currently in the process of verifying several other incidents. The sanctity and neutrality of healthcare, including of health workers, patients, supplies, transport, and facilities, and the right to safe access to care must be respected and protected. Attacks on healthcare are in violation of international humanitarian law. Prior to the conflict, Ukraine had experienced a recent surge of cases of COVID-19. Low rates of testing since the start of the conflict mean there is likely to be significant undetected transmission. Coupled with low vaccination coverage, this increases the risk of large numbers of people developing severe disease. Critical shortages of oxygen will have an impact on the ability to treat patients with COVID-19 and many other conditions. At least 3 major oxygen plants in Ukraine have now closed, and we're seeking ways of accessing oxygen from neighboring countries and ways to deliver it safely to where it's needed. Mass population movements are likely to contribute further to transmission of COVID-19, potentially increasing pressure on health systems in neighboring countries. As of yesterday, the UN High Commissioner for Refugees reported that more than 870,000 refugees have left Ukraine, and we expect that number to increase rapidly. WHO is supporting neighboring countries to address key health issues among refugees and forcibly displaced persons, including mental health and psychological assistance, as well as treatment for diseases including HIV, TB, and cancer. WHO remains committed to meeting the health needs of the people of Ukraine. Now to COVID-19. It's encouraging to see that deaths from COVID-19 are now declining globally and in most regions. And it's pleasing to see some countries being able to relax restrictions without their health systems being overwhelmed. But it's far too early to declare victory over COVID-19. There are still many countries with high rates of hospitalization and death, and low rates of vaccine coverage. And with high transmission, the threat of a new and more dangerous variant remains very real. We continue to urge all people in all countries to exercise caution, and we urge all governments to support their people to protect themselves and others. The only sustainable way out of the pandemic is to reach high vaccine coverage in all countries. Globally, 56% of the world's population has been fully vaccinated, but only 9% of the population of low-income countries. We're now overcoming many of the supply and delivery constraints we faced last year, with more than 1.3 billion doses of vaccine delivered by COVAX, and the supply outlook for this year is positive. We must now turn our attention to addressing the crucial question of how we turn vaccines into vaccinations, how we ensure all countries have enough tests, enough oxygen to treat patients, and enough PPE to keep health workers safe. And we call on all governments to continue with surveillance to track the virus, as well as testing to make sure patients receive the right treatment. To achieve all our targets, we're calling on all countries to fill the urgent financing gap of $16 billion for the ACT Accelerator. Germany has become the first country to pledge to meet its fair share with a generous contribution of $1.22 billion. Vielen Dank, Germany. And we look forward to other countries following your lead. We must also remember that the effects of the pandemic go far beyond the death and disease caused by the virus itself. In particular, COVID-19 has taken a heavy toll on mental health. A new WHO report estimates that in the first year of the pandemic, the global prevalence of anxiety and depression increased by more than 25%. The greatest increases in depression and anxiety were found in places that were the most affected by COVID-19, where infections were high and social interaction was restricted. Our review found that females were more affected than males, and younger people, especially those aged between 20 and 24, were more affected than older adults. This increase in the prevalence of mental health problems coincided with severe disruptions to mental health services and underscored chronic underinvestment in mental health, leaving huge gaps in care for those who need it most. By the end of last year, some services had been restored, but too many people remain unable to get the care and support they need. WHO has worked with partners to lead an interagency response to the mental health impacts of COVID-19 by disseminating guidance, tools, and resources for responders and the general public, and by supporting countries to integrate mental health and psychosocial support in their response. Christian, back to you.
Thank you very much, Dr. Tedros. Now we come to the question and answer session, and please raise your hand with the raise your hand icon in order to get into the queue. And I believe I still owe you the title of Dr. Sosifol, who we have with us. He's Assistant Director General for Emergencies Response here at WHO at the Emergencies Program. So apologies for this, and we start right away with the first question, and that goes to Michael Buchikiv from CNN Opinion. Michael, please unmute yourself.
Good afternoon. Can you hear me?
Very well. Please go ahead.
Okay, so I'm talking to you from the city of Lviv in Western Ukraine. Director General, I ask this question of you with the utmost respect. As you may recall, I used to work for UNICEF. I was a spokesperson globally for a while and also in places like OBT. I've been hearing from staff in various UN agency offices here in Ukraine and elsewhere, asking me or bringing to my attention that in those statements, including the one you mentioned today, which of course is very useful and the world needs to hear, that the name of the aggressor, Russia, is nowhere to be found. I've also found this in statements with UNICEF Executive Director, also UNHCR. And I realize that in times like this, it's very difficult to call out a member state. But as we all know and verified by international news organizations and others, that children's hospitals have been targeted, schools have been targeted, places which should be safe haven for children have been targeted. When I was spokesperson for UNICEF, whether it was the Myanmar generals or warring sides in the Middle East, we would call them out. So my question is this, and sorry for rambling on a bit, but have we reached a point where these types of unforgivable actions are happening before our very eyes, and again, verified by credible parties, that we are not able to call out a member state? Thank you very much.
Thank you very much, and I believe we start with Dr. Mike Ryan.
Thanks for your commentary. We work all around the world, every night and every day, in the service of people affected by conflict and the conflict that is generated by so many aggressors around the world, be it in international or national conflicts. There's no doubt in this case that the military operations, invasion, whatever you want to call it, in Ukraine is causing untold suffering to the people of Ukraine. WHO does not want to be drawn into the politics of that process, but there is no question, and the DG has always made it clear, that he has always been on the side of peace. He speaks about health for peace and peace for health. He speaks that there can be no health without peace. He has always done that. What we try to do is honour the organisation's commitment to standing beside those who are suffering and leave the politics of punishing perpetrators to others who are better capable of doing that. But that is not to say that we don't condemn aggression on civilians at every point. And we've seen this, and we've called out on attacks on healthcare, not only here, but in Syria and other places, and we have taken a very strong position on attacks on civilians and attacks on healthcare. We are not politicians. We are a healthcare organisation. But the Director General has been clear each and every time we have come across a situation like this to speak for the need for humanitarian access, for people to stop fighting, for peace to be put in place so health can be preserved. So I don't think WHO is in any way unclear in our position on this. From our perspective, we call on the parties and particularly call on the government of Russia to reconsider its position in the light of the suffering that's being generated in Ukraine.
Thank you very much, Dr. Ryan. And next question goes to Sophie Mokena from South African Broadcasting Corporation. Sophie, please unmute yourself.
Thank you. The question is directed to Dr. Tedros. Dr. Tedros, as the head of the Global Organization on Health, your concerns around the conflict in Ukraine, have you been able to speak to the authorities from both countries, particularly at the heads of state level, raising your concern around allowing humanitarian assistance or that corridor and also the emergency supply so that the vulnerable can be assisted, who are in this case women and children, but also people from the diaspora from different countries in the diaspora from different countries who are now struggling, particularly in the borders. Have you been able to speak to President Putin and President Zelensky to say we need a passage or a corridor so that we can continue with health at the time where the world is struggling with the pandemic? I don't know whether history is repeating itself. 2018 Spanish flu, it was just immediately after the World War.
Thank you very much, Sophie, and Dr. Tedros, please.
Yeah, thank you, Sophie, for that question. We haven't spoken to them yet, but it's very important to do that. Our first shipment is arriving tomorrow. Of course, we have indicated today in my statement, I have indicated that we will need a corridor to support the needy. So since we are now sending the supplies from Dubai and other hubs that we have, we will engage authorities in order to get access. We had a meeting yesterday of UN agencies, and one of the challenges we have identified is access problems, and this has to be addressed, and the right authorities should be contacted in order to give access. Although tomorrow's flight will be the first one, but we will have more, and there will be a need for access to those who need our support. Thank you.
Dr. Ram, please.
Can I just supplement? I think the question you've asked about humanitarian corridors is very important, and I know the ΟΥΚΡΑΝΙΑЙΙ, under the leadership of Martin Griffiths and Red Cross and others, are really engaged with that priority now, which is to assure humanitarian corridors for access for aid. We've got a warehouse full of supplies in Kiev, and we need to get those out. We've got oxygen supplies ready to come in from outside. We've got as DG said, the planes landing in Poland with very specialized medical supplies. We're talking surgical equipment, debridement equipment, resuscitation equipment, major trauma equipment. We have pre-positioned those supplies, as the DG said, in a number of hospitals before this. And again, to remind people listening in, WHO is not going into Ukraine. We have always been in Ukraine. We have been in Ukraine for years, working with the government on the health system development, on the crisis since 2014 in Donetsk and Luhansk. We have engaged in mass casualty management and major surgical training in hospitals all over Ukraine over the last number of months. Adelaide and others may wish to speak to that, or Heather, who's online. We have been preparing and working with the Ukrainian health authorities. We have a very deep, and the DG has a very deep and strong relationship with ministries of health all over the world, not least of which with the Ministry of Health in Ukraine. Our primary purpose now is to sustain and preserve the health system in Ukraine, that it may serve the people of Ukraine, and we will do everything in our power to make that happen. But as you said, we cannot do that if we cannot get there and surge and support our staff, if we cannot bring supplies in, if we cannot bring oxygen in, if we cannot distribute the supplies we already have in the country, then we are blocked. So humanitarian access, corridors, moments of peace, anything that can be done to create a situation where we can move supplies, move patients, move other things, will be hugely beneficial at this point. But right now, in the chaos of what's happening there, it's very hard to see how that can be achieved in the coming days. And that's why the tragedy unfolding for the people of Ukraine is so avoidable and so unnecessary.
Thank you very much for this. And I'm looking into the virtual room if Dr. Heather Popovich, Incident Manager Euro, as indicated, wants to maybe add.
Thank you. Put really well. And just to add that we are there in Ukraine, and even though there's access issues, we're still working directly with the government through cell phones, any way we can. We're coordinating partners. The health cluster is very active. We're conducting risk assessments and really doing what we can, even if we're not able to move around. So we're still trying to support as much as we can access to emergency health care. And I don't know if Jarno wants to add a little bit more.
Yes, please, Dr. Jarno Habicht, Head of Office for Ukraine, please.
Thank you, and thank you to Dr. Tedros, Mike, Heather, summary. And yes, we have been working with Ukraine, and we are working now, and we continue to work. And for the arrivals tomorrow that Dr. Tedros also mentioned, we have agreement to use logistic as much as possible what is available from authorities to ensure that we are getting all those goods to the hospitals closest where the needs are. But the corridors and protecting the healthcare workers is the most important. In the past days, my main discussions with the Minister of Health is how do we ensure that healthcare workers are protected. So it is about humanitarian law. It is about protecting the healthcare workers who have went through last 2 years on treating COVID, ensuring that there is access to care. And now this will put them under huge stress. Many of them with whom I talked yesterday are working from the shelters, have repurposed their hospitals. We have a number of cities, especially in East, where hospitals and the cities are isolated. And in those places, necessary oxygen in the coming weeks. So it's avoidable and very important that the access is ensured as soon as possible. Thank you.
Thank you very much, all. And we move to Denise Rowland from the Wall Street Journal. Denise, please unmute yourself.
Oh, hello. Hi. Thanks very much for taking my question. So it's on Ukraine as well. I've seen the WHO highlight a problem with oxygen supplies, that this is running out in some places. Are there any other specific medical supplies or drugs that are in shortage or already run out? And I've also heard concerns from WHO about the polio vaccination campaign that was underway in Ukraine prior to the fighting. And I was curious about what steps you're taking on the ground there to reinstate that, what's actually possible at the moment. Thank you.
Thank you very much, Denise, and we'll go to Dr. Habich, the head of office in Ukraine, for specifying here. Thank you.
Thank you. And the three things to mention here. One is on oxygen. Oxygen is particularly needed in some of them hospitals which are getting isolated. So there the treatment, we need oxygen for the treatment. And for that one, again, the same safe passage, because under the current situation, it's difficult even to find drivers who are willing to drive and to bring the oxygen from some of the factories which still have reserves. But as was said before, 3 of the factories are now closed as well. So there are reserves still, which is a positive news, but we need to ensure that that oxygen reaches to the hospitals where the patients are. When we talk about specific medicines, it really varies from hospital to hospital. Those hospitals which are isolated will have need for different type of medicines, but also more and more the trauma kits, because this is what we see from violence, and the needs are different. There is no time to treat about chronic diseases, but the key is to ensure life-saving treatment. So it is the situation varies from east to west and where the military offensive takes place. And the third, on the IPV campaign that was taking off from the 1st of February to do the catch-up campaigns, it started from the Western Oblasts. So the public health authorities are trying to do their best in Rivne, in Sarkapatia, in other oblasts to still continue, but it is becoming very, very difficult. Thank you.
Thank you very much for this very good picture here. And we go to Dr. Adelheid Marschang here, the Senior Emergency Officer at WHO.
Thank you, Christian. And in complement to what Jarno has already said, just to highlight that we are reviewing the situation and the health risks on a daily basis. And indeed, we have looked into specifically what medicine shortages we may be facing. And we do have indications that we may have or face imminent shortages of cancer medicines, that insulin, as Jarno had highlighted, non-communicable chronic diseases are an issue, that the lack of insulin and not having access to diabetes supplies can result really in grave situations for the people with some type of diabetes. We are looking into that and tracking and trying to set up a tracking system that will inform us of the specific needs and medicine shortages. We also see that as the lines of controls are changing and health facilities are changing in their way of working, possibly, that we will face also issues with getting supplies to them in the near future. Over.
Thank you very much for this. Next question goes to Mose Appelblatt. He's from the Brussels Times. Mose, please unmute yourself.
Yes, thank you very much. I would like also to come back about Ukraine. You mentioned, the surge in infections before the invasion, the start of the war. And we know, as has also been said before, previously, that the vaccination rates in both Russia and Ukraine are very low. And as you said also that now during the war, there's almost no testing going on. So I wonder, is it possible, or have you already done it, to, let's say, estimate or predict how the war, if it continues without any ceasefire soon, how will that, let's say, influence the COVID-19 situation in Ukraine when it comes to infection rates and the number of people which are severely ill and will need, let's say, treatment at the hospitals, which I suppose now are overwhelmed by people with war injuries or have even been bombed. And also you mentioned that people are fleeing on the roads and so on, so lots of mass gathering and so on. How will all that affect, the situation in Ukraine?
Yeah, thank you very much, Mose. So you're asking about the vaccination rates on COVID and the situation for COVID and the outlook there in the country. So let's go to Dr. Jarno Habicht again, the head of office, and then we'll elaborate further. Thank you.
Thank you. And when we look to the COVID trend and the wave that started in Ukraine in the beginning of February, it reached to the peak in the middle of February, started in the beginning and reached to the middle of peak in the middle of February to the peak. And we saw that actually from all the COVID hospital beds, only 35% were occupied. So let's put it in this way. This time it was milder than all the previous waves that we saw in the autumn and spring 2021. At the same time, the oxygen is an issue because we still have a lot of vulnerable and more elderly people in the hospitals who need oxygen support. So in those territories where the military offensive takes place and where hospitals are getting isolated and where we don't have access, but also it's not only about oxygen, it's also about electricity, it is also about the medicines. There it is difficult. We don't have exact numbers, but also, as was said by Adelheid and others, we are tracking the situation in the best possible way. On vaccination coverage, it varied. When we look to Kiev city, then Ukraine reached to 65% of post-doses vaccination. But where is the vulnerability is Donetsk and Luhansk, where the vaccination coverage was reaching only to the 20%. So we see huge variation. And before, if I think back 2 weeks, what we discussed, we were preparing how to really go from village to village. We just selected 200 villages to reach those who are vulnerable, 65 plus population. So we are concerned especially for those who are 65 plus and to ensure that they have vaccination coverage. But in the current circumstances, we need to assess, we need to ensure that there is a safe path of the healthcare workers to those households, those people, and these are the negotiations that need to take place at a very high level. Thank you.
Thank you very much. And Dr. Sosifal, Assistant Director General, Emergencies Response, please.
Thank you, Christian. To complement our representative, the impact of the conflict on COVID-19 is already very big because we have seen a huge decrease in terms of capacity to test. Last week only we have seen more than 80% reduction in the number of PCR tests performed in the country. And the other issue is the disruption of health services in terms of clinical management for COVID. We already talked about the oxygen supply, but the risk is to see very high case fatality rate, as we have seen in other conflict-affected countries like Yemen, where we have more than 18% case fatality rate. So making sure that we have the continuity of services, because the health workers also will leave the hospital when it's not safe. So it's very complex, and we are at risk of seeing people dying from condition we can really treat, and this is really, really bad. Thank you.
And Dr. Ryan, please.
Just to add, when we talk about, you know, I think the estimate just last week was there was about 2,000 people on oxygen, high-flow oxygen for COVID in Ukraine. There's 2,000 people that need oxygen to survive, and that number, you know, it hasn't changed. And in fact, if anything, that number has gone up because we have people with injuries, people undergoing surgery who need oxygen. We have children with childhood pneumonia. We have women in difficulties in labour. So oxygen is not just life-saving in COVID. Oxygen is life-saving, full stop. And you need it when you need it. You can't wait till tomorrow for oxygen. You can't wait till next week. You can't be put on a waiting list for oxygen. You can't stand in a queue for oxygen. Oxygen saves your life right now. And when you need it, you need it. And Ukraine needs that. That's just one example, as Sose has said, but it's a very clear example that if we do not get oxygen into the system and other critical drugs, people will die needlessly. They're dying needlessly to start with, but there's a secondary level of needlessness. And when you see the images, and we've all seen them here ourselves, and you know, some of us have been in this game a long time, and we've developed very thick skins, but when you see nurses mechanically ventilating infants in basements of hospitals, you know, even the toughest of us, we struggle to watch that. And those heroes who are there, those mainly women, might I add, in those basements who are taking care of those kids. But if you're a 65 or 70-year-old in an ICU, no one can carry you down the stairs to the basement. So many patients in adult ICUs cannot be moved. And they're being cared for by doctors and nurses while the bombs fall around them. You know, it's really important that we don't just break this down into supplies and break this down into commodities that we have to deliver and corridors, and we speak in these very abstract terms around what's needed. You know, people's bodies and people's bones have been broken, people's lives are being lost, and there isn't a health service available to be able to deliver life-saving care. And we can't supply that health service at the moment. So something has got to move and something's got to change to create the conditions in which that can happen. We need to be able to, as we've seen with insulin, again, you can't wait for your insulin. In fact, those planes that are arriving today and tomorrow have pretty good supplies of insulin on them. So that's one product that we definitely need to get into the country. So I do think we need to step back and also admire and really, I just could not believe the bravery of those frontline health workers, and they're a shining example to the world of what the health system should be doing everywhere.
Thank you so much for this. We'll move on to Priti Patnaik from the Geneva Health Files. Priti, please unmute yourself.
Good afternoon. Thank you for taking my question. We know that the pandemic is far from over, but is the WHO under pressure to consider declaring the end of the pandemic sometime in 2022, particularly because COVID-19 vaccines production will reach a surplus soon, and this will inevitably have an impact on the discussions at the WTO around the TRIPS waiver. It will be good to know the circumstances under which the organization will declare an end to the pandemic. That will also have an impact on the contracts of pharmaceutical companies on pricing and patents and so on. Thank you.
Thank you very much, Priti, and we move to Dr. Maria van Kerkhove, COVID lead.
Yes, thanks. So I'll start, and others I'm sure will come in. So I think we would like nothing more to say that this pandemic is over, but unfortunately we're not there yet. With the fact that we are still seeing incredibly intense transmission of Omicron worldwide, This variant has quickly replaced Delta in circulation and detection around the world. Many countries have passed their peak of transmission of Omicron, but many have not. And we have seen in a number of countries the amount of death that has been reported from Omicron has in fact been higher than it was in the Delta wave, in their Delta wave that they experienced. And this is because of the sheer volume of cases that we've seen from Omicron. And even though intrinsically it's less severe than Delta, the number of people that have required hospitalization and have died from Omicron has been higher in a number of countries. And this is due to a number of factors. One is because of the sheer volume and the burdening of the healthcare systems around the world that are fragile from past waves of infection. Second is because we have not reached the vaccination coverage levels that we've needed in all countries, and in particular, reaching those who are most vulnerable. In the countries that have seen higher amounts of death in the Omicron wave compared to Delta, we've actually seen that this is in fact in populations who are not vaccinated, who have not received the full course, people who are of older age, people with underlying conditions. And this, we've used this word avoidable a lot today. This is also avoidable. So reaching the vaccination coverage, the 70% that the Director General has outlined of reaching 70% of all populations in all countries, it's who within that 70% that is really critical. The SAGE recommendations have been very clear on who we need to target in all countries. These are people of older age, these are people of underlying conditions, these are our frontline workers. And in fact, we have not reached all of those individuals in all countries. So that is our target. That is who we are aiming to reach in all countries. And no matter what is happening out there in the rest of the world, we still need to push vaccination coverage as best we can, while at the same time doing everything that we can, recognizing the challenges that all countries are facing right now, and the fact that they're in different situations to also drive transmission down with the tools that we have. So it's both sides of that equation.
Thank you very much, Dr. Van Kerkhoff. Dr. Bruce-Albert, please.
Yeah, thank you very much, Christian. There are two parts to that question, of course, and I think the first one about the end of the pandemic, like Maria highlighted, this is not a function of vaccination coverage. It's what's happening with the epidemiology and the virology that drives this. And remember that the surge we are seeing now of Omicron is just the most recent surge of this virus. So it is going to be a function of time and the control measures that are going to tell us when we are approaching the end of the pandemic. Important point, as Maria says, is we have the knowledge, we have the tools to get there, only if we apply them everywhere. Vaccination rates become really important because the higher we can get the vaccination, the faster we're going to get there and drive this. But there was a second part of the question, and that was about the vaccine supply being secured. And I think we need to be clear here. We're in a situation right now where, yes, we do have a lot of vaccine, increasingly a lot of vaccine that is available. That vaccine is not in the arms of the people that need it everywhere, as Maria highlighted. And one of the appeals the Director General led 10 days ago was for the additional financing that's needed to make sure that the vaccines turn into vaccinations, that the tests turn into actual testing results, that the oxygen, et cetera, actually gets to the people that need it, and that requires another $16 billion. So there is also a price tag to getting us faster to the end of the pandemic. And the last point was just in terms of that supply. Well, we have supply. We still have that problem we started the pandemic with, and that is that the control of that supply is really in very few hands, and the only way that we're going to be able to ensure security globally in the future is exactly as you highlighted, and that is the more geographically and fairly distributed means of production as well, and we are not there yet. Important work's been done. You saw over the last few weeks some very important announcements about the new WHO mRNA hub in South Africa. There are many spokes now off of that hub, a huge effort to move it's a bit of a Manhattan Project in some regards, and moonshot to try and get additional capacity built out around the world as rapidly as possible to be able to manage that aspect as well.
Thank you, and Dr. Kayla O'Brien, please.
Yeah, I want to amplify some of the things that Maria was referring to. The 70% target is the target for achieving the goals related to vaccination and reducing transmission, but most importantly, reducing disease that is severe and death. And I'll give you an example that it's not 70% of just anybody in the population. It really is about those who are most in need of vaccination to protect them directly from disease. And we're still quite a distance from that. Just an example from the Africa region, with 23 countries where about 35% of the health workers have been fully vaccinated. Similarly, for those who are older adults, about 25% of older adults fully vaccinated, and similar numbers, a little bit lower for those with underlying medical conditions. So the real emphasis in every country is about getting 100% coverage of those who are most needing the vaccine, 100% coverage of health workers, 100% coverage of older adults, 100% coverage of those who have underlying medical conditions, on the way towards a 70% coverage of the whole population. So this is really where the focus has to be. That's what will take the pressure off the health system, because that's what's really underlying the cases that are in hospital and the deaths that are occurring. Thanks.
Thank you very much.